COVID-19 vaccines right around the world to make sure no one is left behind. That must include the most vulnerable, including those languishing in refugee camps or indeed in war-torn conflict zones. That's the focus of our discussions today, and I very much look forward to a very constructive discussion with all of you. The provisional agenda for this meeting is maintenance of international peace and security, implementation of Resolution 2532 of 2020. And so with your permission, I will adopt the agenda. Next, we move on to the invitations under Rule 39. And in accordance with Rule 39 of the Council's Provisional Rules of Procedure, I would like to invite the following briefers to participate in the meeting. Ms. Henrietta Foray, Executive Director of the United Nations Children Fund, Mr. Jagan Chapgayan, Secretary General of the International Federation of the Red Cross and Red Crescent Societies, and Dr. Seth Berkley, CEO of Gavi. It is so decided. Now we move on with all of your permissions to consideration of item 2 of the agenda. And so I will draw the attention of council members to document S/2021/138, which is a letter dated the 12th of February 2021 from the permanent representative of the United Kingdom to the United Nations, addressed to the Secretary General and transmitting a concept paper on the item which is before us under consideration. And with that in mind, I will now give the floor to Secretary General, His Excellency, Mr. Antonio Guterres, to make his introductory remarks. Antonio, over to you.
Thank you very much, Mr. President, and with your permission, I would make a brief introduction and then ask my colleague Henrietta Foray, Executive Director of UNICEF, to develop our briefing. Excellencies, ladies and gentlemen, I thank the United Kingdom for organizing this meeting and for reinforcing my call for a global ceasefire to ease suffering, create space for diplomacy, and enable humanitarian access, including for the delivery of vaccines worldwide. COVID-19 continues its merciless march across the world, upending lives, destroying economies, and undermining the Sustainable Development Goals. And the pandemic is exacerbating all the factors that drive instability, hindering our efforts to implement Security Council Resolution 2532 for the cessation of hostilities, for conflict prevention and resolution. Defeating COVID-19, now that we have begun to have the scientific capacity to do so, is more important than ever. The rollout of COVID-19 vaccines is generating hope. But at this critical moment, vaccine equity is the biggest moral test before the global community. We must ensure that everybody, everywhere, can be vaccinated as soon as possible. Yet progress on vaccinations has been widely uneven and unfair. Just 10 countries have administered 75% of all COVID-19 vaccines. Meanwhile, more than 130 countries had not received a single dose. And those affected by conflict and insecurity are at particular risk of being left behind. When pandemic strikes, we are only safe if everyone is safe. If the virus is allowed to spread like wildfire in the global south or parts of it, it will mutate again and again. And new variants could become more transmissible, more deadly, and potentially threaten the effectiveness of current vaccines and diagnostics. This can prolong the pandemic significantly, enabling the virus to come back to plague the global north. And it will also delay the world economic recovery. We have come together to create the COVAX facility, the one global tool to procure and deliver vaccines for low and middle-income countries. COVAX requires to be fully funded. But we must do even more. Our efforts need to be comprehensive and well-coordinated everywhere. The world urgently needs a global vaccination plan to bring together all those with required power, scientific expertise, and production and financial capacities. I believe the G20 is well placed to establish an emergency task force to prepare such a global vaccination plan and coordinate its implementation and financing. This task force should include all countries in which there is a capacity to develop vaccines or to produce them, if licenses are available, together with WHO, Gavi, other relevant technical organizations, and international financial institutions. And the task force would have the capacity to mobilize the pharmaceutical companies and key industries and logistic actors. I am ready to galvanize the full United Nations system in support of this effort. The G7 meeting later this week can help create the momentum to mobilize the necessary financial resources. Together, we can ensure sufficient supply, fair distribution, and vaccine confidence. And we can defeat this disease. We can get our economies running again. I am convinced it's possible. Let's make it happen together, and I thank you.
Thank you, Secretary General, for your remarks. And now I understand that the Secretary General has to leave the meeting at 9:25 a.m. because of other pressing commitments and priorities. So can I also just take this opportunity to thank you for all of your work, your leadership, and indeed the work on the front line of so many UN staff right around the world. I'll now give the floor to Ms. Henrietta Fore.
Thank you very much, Secretary General, Excellencies, fellow briefers, Secretary Raab. Thank you for convening this debate. UNICEF appreciates the United Kingdom's efforts to shine a light on the importance of equitable access to the COVID-19 vaccines. The only way out of this pandemic, as the Secretary General has just said, for any of us, is to ensure vaccinations are available for all of us. In this historic effort, we must include the millions of people who are living through or fleeing conflict and instability. Equitable access to vaccines for all people, including those living under conflict, is essential. Not only is it a matter of justice, but as the only pathway to ending this pandemic for all, and to sowing the seeds of care, of hope, and even peace in countries that have seen far too little. For UNICEF and our many humanitarian partners working around the world, COVID-19 has fundamentally altered our responses, adding a new layer of complexity in some of the most difficult and dangerous operating environments anywhere. As this Council knows well, the violent, protracted nature of today's armed conflicts shatters countries' health system, damaged or destroyed vital infrastructure like water and sanitation, and spurred the flight of badly needed healthcare workers. In this context, vaccine delivery is also hampered by a funding gap for humanitarian support overall, and by a lack of transportation, cold chains, logistical infrastructure to support the rollout. We need to reach the same populations that are routinely missed with basic services like health, nutrition, and basic immunization, with a vaccine that will not only potentially save their lives, but also help to address the global pandemic. UNICEF is proud to support the WHO-led global response, and we're bringing our decades of experience and expertise to this massive act. We are working with our partners and governments to support country readiness. With our vast field presence in every country, we are working with local and national authorities on preparations and strategies to reach all people, including those in hard-to-reach locations. Using existing immunization infrastructure, we are also working to reach people who are not normally targeted in our immunization programs, including health workers, the elderly, and high-risk groups. And we're helping governments to establish pre-registration systems and prioritizing which people, such as healthcare workers, need to receive vaccines first. We're engaging communities and building trust to defeat misinformation. We are training health workers to deliver vaccine and helping governments to recruit and deploy more health workers where they are needed most. We're advocating with local and national governments to use other proven health measures like masks and physical distancing. And now, through the COVAX facility, we're working with Gavi and WHO and CEPI to procure and deliver the COVID vaccines in the close collaboration with vaccine manufacturers and freight and logistics and storage providers. And we're doing so on a dramatically accelerated timeline. We're aiming to procure 2 billion doses of COVID-19 vaccines by the end of this year, 2021. This is on top of the 2 billion doses of other vaccines we normally procure each year on behalf of 100 countries. With our long-standing work in humanitarian contexts, we're adapting, adjusting, and assessing the specific needs in each location. This means, for instance, ensuring that enough doses and syringes are available in each country and undertaking inventories to ensure that effective cold chain systems are in place. It means procuring those syringes and safety boxes. It means finding ways to ensure distribution and delivery in logistically difficult contexts like Sudan or the Democratic Republic of Congo, or high-threat environments like Yemen or Afghanistan. It means negotiating to populations across multiple lines of control by non-state armed groups, areas that the ICRC estimates represent some 60 million people. It means ensuring that all population groups, including those that are routinely excluded from support, are covered by national vaccination plans, no matter their legal, economic, or political status. This includes refugees, migrants, and those who are deprived of their liberty. And we've joined a global effort to secure vaccines under the humanitarian buffer that can be used as a measure of last resort. COVAX has set aside 5% of its doses as backup stock for at-risk populations like refugees, the internally displaced, and migrants. In short, it is a safety net for those not covered by national immunization programs. But as we prepare for this historic rollout, we need the support of this Council. So may I build on the Secretary General's calls. First, join our call to all member states to ensure that everyone is included in national vaccination plans, regardless of their legal status or if they live in areas controlled by non-state entities. Second, we need a global ceasefire. At a minimum, we need your help to extend the call made in Resolution 2532 for a humanitarian pause for the duration of the vaccine delivery and administration. And third, help us to restart stalled immunization campaigns for other diseases like measles, diphtheria, and polio. We cannot allow this fight against one deadly disease to cause us to lose ground in our fight against others. Over the last year, the global community has come together to develop, manufacture, distribute, and deliver this vaccine in record time. So in closing, may I say that this historic effort deserves historic support. Help us ensure that the light at the end of the tunnel shines on us all, including the families and communities enduring the horrors of conflict. Thank you very much, Mr. Chairman.
Thank you very much, Ms. Four. Thank you for your briefing and for all the work that the Children's Fund is doing. I now turn and give the floor to Dr. Seth Barkley.
Mr. President, Mr. Secretary General, Excellencies, thank you for inviting me to brief the Security Council on a topic that will define our common success in addressing the pandemic through equitable access to vaccines. Let me also thank my partners, Henrietta and Jagan, who are here with me today. For a global pandemic, as the Secretary General has said, we're only safe if we're all safe. If there are countries where large numbers of at-risk people are not vaccinated, it not only threatens those countries, but the rest of the world as the new variants popping up in different countries attests. So the first goal is to assure equitable access, but we can't stop there. To succeed, we need to ensure that vulnerable at-risk populations everywhere have access to life-saving vaccines. This means not forgetting the millions of people in conflict-affected settings, for it is in these last-mile communities where the meaning of equity is most pronounced. The COVID-19 pandemic has laid bare deep systemic inequities between and within societies, exacerbating grievances and conflicts along the way. Progress on poverty eradication, nutrition, education, and immunization coverage have all fallen back, and the poorest and most vulnerable communities are hardest hit by the pandemic. Despite the UN Secretary General's call for a global ceasefire, conflicts and political violence have continued or even intensified. The pandemic is more than a global health crisis. It's a significant challenge to international peace and security that can only be addressed through multilateral cooperation. Global GDP is expected to fall by as much as $9.2 trillion in 2021 if countries continue to pursue an uncoordinated approach to vaccine distribution. This only weakens our collective ability to ensure peace and stability. For over 20 years now, Gavi, the Vaccine Alliance, has worked to give the protection of new and underutilized vaccines to more than 800 million children and to support global health security by financing global stockpiles for epidemic diseases such as Ebola, horribly in the news this week again. Our target for the next 5 years is to reach children who received no routine vaccines, the so-called zero-dose children, 2/3 of whom live below the poverty line, and an estimated 40% living in settlements affected by fragility. Vaccines work against poverty and conflict, too, by giving children in particular the same life chances that makes access eligible. Sadly, there is a correlation between conflict and underperformance in immunization. Countries in the Gavi family that are not suffering from fragility reach on average 83% of children with the first dose of vaccine, while countries affected by conflict, this drops to 65%. This is further compounded by challenges to healthcare provision in conflict and fragile settings where access to healthcare and infrastructure are disrupted or restricted where they're needed most, furthering exacerbating the deprivations and inequalities and driving displacement. In response to this, Gavi's fragilities, emergency, and refugees policies provide greater health systems funding and flexibilities to eligible partners and countries. But it isn't just the vaccine. It's also, as Henrietta said, the supply chain, the bravery and professionalism of the health workforce, and the development of humanitarian actors that is totally essentials. After all, vaccines don't deliver themselves. So now let me come to the biggest test of a multilateral system in a generation. As I have long said, epidemics and pandemics are an evolutionary certainty, and vaccines, where they exist, are an essential tool in preventing these and protecting us all from new diseases. They're an essential investment in both national and international security. A health budget is a defense budget, and investing in vaccines for COVID-19 and for other diseases is a fundamental pillar of global health security. Along with securing and supporting populations impacted by conflict, it's important to consider pandemic preparedness, disease and virus surveillance, and security of supply lines, security of health workers and facilities. That is why, as my colleague Henrietta Fore explained, COVAX and its goal for equitable access is so critical to ending the acute phase of the pandemic. And this goes hand in hand with access to diagnostics, therapeutics, supply chains, and health systems innovations. As part of the COVAX facility, a proposed humanitarian buffer will enable access to COVID-19 vaccines for high-risk populations in humanitarian settings, especially where they are at risk of being excluded or where governments and health ministries have no access due to conflict. While we work on this safety net with the strong support of our humanitarian partners in the Interagency Standing Committee, COVAX and our partners are clear that the first resort for covering all the high-risk groups, irrespective of their legal status, is their inclusion in the country's national vaccine plans. The humanitarian buffer is but a measure of last resort. I ask that the UN Security Council to reinforce this message so that available doses are distributed to ensure truly equitable access in accordance with the humanitarian principles and in upholding state obligations towards populations within their territory. COVAX has secured 2.3 billion doses of vaccine in advanced commitments and options for 190 countries in 2021. Of these, at least 1.3 billion doses are reserved, but not fully paid for with donor funding. These doses are meant for 92 lower-income countries eligible for the COVAX advanced market commitment, which could increase to a further 1.8 billion doses that could be delivered with additional financing. Given the new variants, it is clear that we will have to adapt vaccines and strategies, and this may further increase the required cost. It's critical that donors and countries step up with additional funding, that manufacturers prioritize multilateral initiatives over bilateral deals with short-term profit, stop inequitable vaccine diplomacy, that research and development and essential scientific knowledge is shared, and that the family of nations represented by the United Nations pull together and prepare for the largest logistical effort in immunization the world has ever seen. It's also fundamentally important that where the vaccines are available, the Security Council plays its critical role in enabling supplies to move into conflict-affected settings via neutral humanitarian actors in accordance with international law. Mr. President, Excellencies, as an epidemiologist who has specialized in infectious disease epidemiology over a lifetime, as the head of Gavi, the Vaccine Alliance, and the COVAX facility, I can say that science tells us there is no way out of this pandemic alone. We have to do it together or face generational consequences. Our ask to the Security Council is that they advocate for and invest in this unprecedented effort, that they call on all nations to ensure the unhindered deployment of vaccines in all settings, including those affected by conflict, and into the arms of all high-risk individuals, refugees, or citizens. As we now know, global health security is key to economic and human security, progress, and stability, and we overlook it at our own peril. No one is safe until we are all safe. COVID-19 is the biggest stress test of the multilateral system we've seen in decades. It has affected every person, every community, every country on Earth. We must get this one right, particularly as it is an evolutionary certainty that this will not be the last pandemic. Thank you for listening.
Thank you so much, Dr. Barkley, and thank you for the work you're doing and that Gavi is doing. I now give the floor to Mr. Jagan Chapgayan. Over to you.
Please check your microphone. We can't hear you. Are you on mute, please? Check.
Yeah, you hear me now?
Yes, please go ahead. Thank you.
Yeah, Mr. President, thank you for the opportunity to join this important discussion today. Your Excellencies, dear colleagues, COVID-19 has shown us many things. It has highlighted painfully the weaknesses inherent within our public health systems. It has underlined our interconnectedness and the importance of responding to a global pandemic in a coordinated way. And it has shown the deadly consequences of mistrust. It seems sadly appropriate that I'm speaking to you about trust just days after a new Ebola outbreak was announced in Guinea. The parallels between Ebola and COVID-19, both in terms of the destructive nature of mistrust and transformative capacity of creating trust, are profound. What happened? Couldn't fix it. It was the problem. When communities do not understand health interventions, they will not accept them. Instead, they are likely to see these health measures as threats, which can lead to violence. We saw this many times during the Ebola outbreaks, and we have all seen this many, many times during the COVID-19 pandemic. Put simply, mistrust kills. When science is not only ignored but derided, when the decision to wear masks becomes controversial, and when the wave is filled with absurd rumors, trust in the tremendous efforts to stop the pandemic is severely undermined. When mistrust prevails, it stops people from getting the help they need. It prevents us from ending public health emergencies. It can even lead to people incorrectly blaming others, foreigners, migrants, or other minority groups for the spread of an illness. What can be done? A crisis is not the ideal time to rebuild trust. However, it can be done, but it requires listening and sincerity in acting on what communities tell us. Let me give you an example. Our initial attempts to safely bury Ebola victims in the Democratic Republic of the Congo were met with hostility. So we reached out to communities and we listened. We trained 800 community volunteers to gather community feedback, and we analyzed the results to understand why people were refusing our support. We used what we learned to adapt, both how we handled the burials and how we engaged with communities. And the result of this diligent, patient work was that refusals dropped from 80% to just 8% by the end of the outbreak. Trust has to be earned. It requires seeking out community feedback and constantly adapting our response to address the concerns and fears that periodically flow through communities. It also requires investment, certainly more than has been the case during this pandemic. Mr. President, mistrust has consistently undermined COVID-19 response efforts. Now, as we turn to the immunization phase of the global response, earning community trust remains crucial, especially against the backdrop of historically high levels of vaccine hesitancy. As we learned during Ebola, people trust us for our actions. They look at what we do and they judge us for what we do not do. They see clearly the current high levels of vaccine inequity and inequality. They see the unfairness, for example, in the fact that less than 1% of vaccine doses globally have been administered in the 32 countries facing severe or very severe humanitarian crisis. The fair and equitable distribution of vaccines is essential to building trust and for maintaining international peace and preventing violence. This is about more than fairness. This is about stopping the virus. However, equity is not something that happens on its own. History tells us that. Just as we need to ensure that all countries can access vaccines, we also need to make sure that those vaccines reach the arms of all the people who need them. Underserved, alienated, or isolated communities, including those living in areas not under the control of states, as well as detainees, IDPs, and refugees, must be integrated in national vaccination efforts. Strong involvement of the International Red Cross and Red Crescent movement and other local impartial organizations in vaccination activities can help ensure that these last-mile communities are not left behind. The efforts of the National Red Cross and Red Crescent societies to maintain routine immunization in contexts like Afghanistan, the Central African Republic, and Pakistan have saved countless lives. This unparalleled access into last-mile communities can just as easily channel COVID-19 vaccinations while maintaining critical routine vaccinations. The vaccination campaign we launched just last month to help vaccinate 500 million people in support of the global efforts was born out of this reach and the trust of our membership at the most local level. How can you as UN member states support these efforts to build trust and integrate last-mile communities into COVID-19 immunization efforts? You can include community organizations such as the National Red Cross and Red Crescent societies in all phases of immunization planning and delivery. By involving these actors, you will gain insight into community misconceptions and misgivings, and will gain sight of those groups and communities that might normally be hidden from your view. Mr. President, I would like to stress the importance of ensuring the safety and protection of volunteers, first responders, and healthcare workers during this pandemic. In 2020, my colleagues at the International Committee of the Red Cross documented nearly 850 incidents of violence against healthcare workers involved in the COVID-19 response, a figure that is both shocking and almost certainly an underestimate. International humanitarian law must be respected. Violence against healthcare workers must not be tolerated. We have a collective responsibility to care for those who care for us. Mr. President, let me conclude by thanking the millions of volunteers who are serving on the front lines of this pandemic. By selflessly responding to the needs of others, each of them create tiny ripples of hope. I believe that these ripples will build trust and eventually turn into the wave that washes away this pandemic. These volunteers prove that humanity is not only alive, but is in fact thriving, giving us all hope for peace and security as we deal with the toughest crisis of our lifetime. Thank you, Mr. President.
Thank you, Mr. Chapgayan, for your briefing and the work of the Red Cross and the Red Crescent. I will now make a statement in my capacity as the Secretary of State for Foreign, Commonwealth and Development Affairs for the United Kingdom of Great Britain and Northern Ireland. Your Excellencies, I am very pleased and honoured to address this first ever Security Council meeting on vaccinations. It is, I think, right that we bring the full weight of the Security Council and the wider UN system to bear on ending this appalling pandemic. The virus, we know, is still on the rise globally with the emergence of new, more transmissible variants, which has itself driven increased transmission in most regions, I think it's fair to say. But with vaccines approved and now being rolled back, we've got that opportunity to fight back. And at last, I think we can genuinely say that we see light at the end of the tunnel, or at least a light that is drawing closer to us. But this has to be a global effort. The pandemic isn't under control anywhere until it's under control everywhere. And we need to think of ourselves as a team working together against a common and very deadly enemy. That's the reality of our struggle. No nation is truly safe until we are all safe. In terms of what that means for us, I think it means that we have to work to secure access to vaccines around the world, including in the hardest to reach places, including places of conflict and other types of insecurity. And at present, we know that more than 160 million people worldwide are at risk of being excluded from vaccinations because of instability and conflict. So we've got a real challenge to meet the shortfalls in securing supplies, delivering vaccinations on the ground. There are many challenges to achieving this, from securing comprehensive humanitarian access to managing vaccine storage. And overcoming all of these challenges and the compound challenge that they present will require greater national, regional, and international cooperation. And the UN will play a key coordinating role as we bring those efforts together. Local ceasefires are going to be essential to enable life-saving vaccinations to take place. And they're essential to protect the brave health workers and humanitarian workers working in incredibly challenging conditions in conflict zones, who are striving to deliver that help, that vital life-saving help, to those who need it most. Ceasefires have been used to vaccinate the most vulnerable communities in the past. There's no reason why we can't do this. There's no reason why we can't, with the will that we can muster, come together to overcome the challenges. We've seen it in the past to deliver polio vaccines to children in Afghanistan, just to take one example. Likewise, the suspension, or at least the postponement of routine non-COVID vaccination campaigns during the pandemic, I think is another grave concern for all of us. So the rollout of COVID vaccines shouldn't displace those programs. They have to go hand in hand. On the 1st of July last year, the Security Council adopted Resolution 2532 on fighting COVID-19 in the most vulnerable countries. And further action is needed now by the Council to call for ceasefires, specifically to enable COVID vaccines to be carried out in those areas that have been so badly affected by conflict. That's why we're proposing a new resolution for this Council's consideration. The COVAX facility is due to start rolling out vaccines this month, and we're proud to host its launch at the Global Vaccine Summit last June, and we're proud to be one of Gavi's largest donors. We will continue to keep up that support. And by calling for vaccination ceasefires and by calling for COVID-19 vaccination plans to include all high-risk populations, including refugees, this resolution and this council really has an opportunity to help get vaccines distributed to the most vulnerable communities across the planet. It would help ensure full access for humanitarian and medical personnel. It would help protect them as they go about their challenging work. And so I would just close my remarks on behalf of the UK by urging all members of this council to support the swift and full adoption of this resolution. Our scientists have done incredible work in developing the vaccine. We must work together now to get those vaccines to the most hard-to-reach communities and the most vulnerable in those hard-to-reach communities. We cannot turn away while those in conflict zones are denied this essential, critical protection from the virus. We in this council have an opportunity, and I believe we have a moral duty to act. Thank you. And I will now resume my functions as President of the Council, and at this point give the floor to His Excellency Mr. Ralph Gonsalves, Prime Minister and Minister for Foreign Affairs of St. Vincent and the Grenadines. Over to you.
Thank you, Mr. President. Let me begin by expressing on behalf of St. Vincent and the Grenadines our appreciation to the United Kingdom for convening today's very pertinent discussion. We also thank the briefers for sharing compelling insights on this very important topic. The number of deaths, the level of economic destruction, and the social dislocations associated with COVID-19 continue to expand globally as new variants of the virus with increased transmissibility threaten to disrupt even the most resilient of societies. Amidst this continuously evolving threat, the question of equitable access to vaccines is of prominent concern, great concern, one of the major issues in contemporary political economy today. The simple truth is that unless vaccines are made available, affordable, and accessible to all, many vulnerable countries and peoples, including those affected by conflict, would suffer unbearably as the pandemic continues to destroy lives and livelihoods. Greater international cooperation amongst all countries, international financial institutions, and major pharmaceutical companies is clearly required. The United Nations and its specialized agencies, such as the World Health Organization, should maintain a central role in ensuring that vaccines can be administered safely, efficiently, and globally to all persons in high-risk categories and more widely to achieve population immunity. In this regard, we would welcome an enforceable international rules-based compact to deliver vaccines to all who need it. We also reiterate the Caribbean Community's CARICOM's call for a global summit in the context of the World Health Organization's Access COVID-19 Tools Accelerator Facilitation Council to discuss equitable access and distribution of vaccines. We in the Caribbean Community, CARICOM, are resolved to share with each other on the basis of need whatever quantities of vaccines we receive or procure. Political will, principled engagements, and solidarity among all nations remain crucial elements for overcoming COVID-19. There is a disturbing trend of vaccine nationalism. Some wealthy countries hoard critical medical supplies, including vaccines. Such conduct only prolongs the pandemic. Many too will suffer needlessly if vaccine delivery is determined by a narrow market calculus rather than the social imperative of building immunity everywhere in solidarity with each other. We urge vaccine manufacturers, as a gesture of good faith towards humanity, to work with developing countries to expand production capabilities, hence alleviating the strain on global supply chains. We also call for greater financial support for the COVAX facility to bolster the global inoculation campaign. During this difficult period, the Security Council must continue working in unison with other organs of the United Nations to address systematically the various dimensions of this pandemic. Our delegation remains fully supportive of all efforts to promote a global ceasefire to arm conflicts everywhere. This ceasefire would afford conflict-affected countries the time and space to advance peace processes and would facilitate the sustained delivery of life-saving humanitarian, developmental, and capacity-building assistance. A ceasefire will also ensure that vaccines can be distributed safely to those made most vulnerable by conflict, including internally displaced persons and refugees. Where mandates and capabilities allow, peacekeeping operations could be utilized to assist with the transportation and distribution of vaccines, including providing protection to those designated personnel who administer vaccines. Mr. President, as we approach the one-year anniversary since COVID-19 was declared a global pandemic, we must work together urgently and intently to build back better. Equitable access to COVID-19 vaccines must form part of any serious effort to recover sustainably from this pandemic. Let us be reminded of our common promise to humanity. Under the 2030 Agenda for Sustainable Development of leaving no one behind. No one is safe and no one will be safe until everyone is safe. And immunity can only be achieved when it is collectively composed. Thank you.
Thank you, Your Excellency, Mr. Gonzalez. And I now give the floor to His Excellency, Mr. Wang Yi, State Councillor and Minister for Foreign Affairs of China. You have the floor.
Stronger international solidarity and closer international cooperation for people-centered response to COVID-19. It was an exemplification of the role of the Security Council. Over the past 7 months, more than 180 countries endorsed the Secretary General's appeal for an immediate global ceasefire. Important progress has been achieved in several countries, including Libya and Sudan, contributing to global COVID response. That said, a new wave of pandemic is still raging. Developing countries, especially those in conflicts or affected by humanitarian crisis, face difficult challenges. We must redouble our efforts for continued progress in combating COVID-19 and upholding peace. In this connection, China would like to underscore the following points. First, we should put people front and center and step up international cooperation against the COVID-19. In the face of this pandemic, nothing matters more than the people and nothing is more valuable than human lives. This is a relay race of working together to save lives. It is not a zero-sum game where one's gain means the other's loss. Countries need to replace division with solidarity and keep to the right path of cooperation to tide over this trying time caused by COVID-19. We need to resist prejudice, respect science, and reject disinformation and attempts to politicize the pandemic. In this regard, members of the Security Council must lead by example. Second, we should earnestly implement the Security Council resolution to create an enabling environment for COVID response. Countries in armed conflicts and affected by humanitarian crisis are weak links in this global battle against the COVID-19. They deserve particular attention. Parties to armed conflicts should earnestly abide by Resolution 2532. They must walk away from the battlefield of armed conflicts and join the fight against the coronavirus. It's important to ensure access for humanitarian assistance, especially for women, children, and other disadvantaged groups. The United Nations need to use well the humanitarian pause to carry out mediation and good offices to advance political settlement. China always opposes unilateral sanctions without Security Council's mandate. Under the current circumstances, we urge the relevant countries to show humanitarian spirit and at least suspend their unilateral sanctions and other forceful measures with no grounds in international law. Third, we should reduce vaccine deficit and give stronger assistance to developing countries. Vaccines are powerful weapons to defeat COVID-19. Thanks to the concerted efforts by governments, businesses, and scientists of many countries, COVID vaccines are being developed and produced at record speed. Nonetheless, several problems need to be addressed urgently. The first is the deficit in production capacity. For the vaccines already put into urgent and conditional use, countries should increase supply by boosting domestic production and through international cooperation in forms of commissioned and joint production. The second is the deficit in distribution. As Secretary General Guterres put it, vaccines are reaching high-income countries quickly, while the world's poorest have none at all. Not only will this result in the immunity divide, but will also widen the development gap. We should come together to reject vaccine nationalism, promote fair and equitable distribution of vaccines, and in particular, make them accessible and affordable for developing countries, including those in conflicts. We must ensure that no country in need of the vaccines is left behind and that no individual waiting for vaccination is neglected. Fourth, we should enhance coordination and give full play to the role of the UN system. The WHO plays a central coordinating role in global actions against the COVID-19. Countries should continue to give stronger political and financial support to the organization, particularly the support needed for it to effectively lead this largest vaccination operation in human history. COVAX provides a crucial channel for developing countries to access vaccines. It should prioritize the needs of developing countries and ensure vaccine supplies for conflict-stricken regions and countries under sanctions. Bilateral actions could form synergy with COVAX. The World Food Programme, UNICEF, and other related agencies should use their global shipping networks to build green channels for developing countries and, in particular, solve the last mile problem for vaccine delivery in Africa. Mr. President, colleagues, President Xi Jinping has announced that Chinese vaccines would be a public good and that China would help realize vaccine accessibility and affordability in developing countries. China has been acting to honor its commitment. China was among the first to join the WHO's Access to COVID-19 Tools Accelerator initiative. We have actively launched vaccine research and development cooperation with more than 10 countries, involving over 100,000 volunteers of 100 plus nationalities. China has joined COVAX and given it strong support. We are making concrete efforts for the equitable distribution of vaccines. At the request of the WHO, China has decided to preliminarily contribute 10 million doses of Chinese vaccines to COVAX to meet the urgent need of developing countries. China has donated vaccines to 53 developing countries, including Palestine, Somalia, Iraq, South Sudan, and Syria in response to their request. China has exported vaccines to 22 countries. In the meantime, China has also been using its strength in industrial chains to help other countries manufacture vaccines in China or locally so as to boost the global production capacity. China has decided to join the UN's Group of Friends initiative to donate COVID-19 vaccines to UN peacekeepers. China's commitment to international vaccine cooperation is not about achieving geopolitical goals or reaping economic benefits or attaching political strains. What concerns us most is to ensure that vaccines become accessible and affordable public goods for people of all countries, namely a people's vaccine. China will work with all parties to step up cooperation on vaccines and COVID-19 preparedness and response to foster a global community of health for all and to secure the ultimate global victory against the pandemic. Thank you.
Thank you so much, Your Excellency, Mr. Wang Yi. And I now give the floor to His Excellency, Mr. Pham Binh Minh, Deputy Prime Minister and Minister for Foreign Affairs of Vietnam. Sir, over to you.